According to our Constitution, access to primary health care is a basic human right. The transgender community believes this should extend to gender transition surgery. The Health Department disagrees.
Ndiso Masbuko is a transgender man. This means Ndiso identifies as male but was born female. He hails from Durban's oldest township, Lamontville.
My real name is Mandisa Mazibugo, but I prefer being called Ndiso, Tamatiso. And I've always never been comfortable being categorized as a girl. You know, sometimes when you in the wrong body, you're not comfortable with how your body looks. Like me, I wasn't comfortable with my hips, I wasn't comfortable with my breast, I wasn't comfortable with my voice, I wasn't comfortable with a lot of things. So those kind of things, they didn't correspond with my personality. Because I felt like I'm a man and I have all these appearances and physical appearances with me that I wasn't comfortable with. So it kind of like kills your self-esteem.
Clinical psychologist Jonathan Bosworth says gender is a spectrum and people should be allowed to be themselves.
So often we conflate gender identity and sexual orientation. We often think of them as the same term or the same concept, but they're actually two different concepts. Another way to put it is kind of gender identity is who you go to bed as, and sexual orientation is who you go to bed with. So you can be transgender and heterosexual, you can be transgender and gay, you can be transgender as lesbian or bisexual.
Ndiso is transgender and heterosexual. He wants to have gender-affirming surgery.
I am looking into having a top surgery.
By top surgery, he's referring to the removal of the breasts.
I don't know a trans man who doesn't want top surgery. It's a generalization, but most trans men want top surgery. They hate those boobs.
Dr. Elna Rudolph says top surgery is a complex but fairly affordable operation.
So many, have found the money somehow to get the top surgery. Bottom surgery, I don't have one trans guy in my practice who's had bottom surgery. I'm sure they are out there, but it's massive surgery, expensive, full of complications.
It is the complicated nature of the undertaking that is making Ndi so nervous about going under the knife.
It's just that in South Africa, a lot of surgeons are not well trained with such things, you know. But we have a KZN group in WhatsApp whereby all the transgenders chats there. So everybody there in the group gives us information on how to get assisted in terms of surgeries and stuff.
Bosworth says being transgender can give rise to other psychological struggles.
If you look at transgender people from a statistics point of view, they do have higher mental health difficulties. It's higher suicide rates, higher depression, higher anxiety, higher substance use, things like that. And that's not necessarily that there's anything inherently wrong with being transgender, but often when you stigmatize or see negative by society, that does create a lot more psychological trauma, a lot more psychological difficulties.
Siamo Nogeri, who is patient number 40 for transgender affirming surgery at Steve Biko Academic Hospital in Pretoria, says government isn't taking their needs seriously.
I get angry and disappointed in the health system in particular, the South African health system in particular. I feel they're not prioritizing the program, and the fact that I might probably be done with the whole process in my mid-40s it's a depressing, stressful, antagonizing fact that I have to live with because there's nothing I can do about it.
After the break.
How about you try to snap from the mail? Oh, bad. I don't think so.
Clueless public healthcare professionals aren't helping the situation.